As the global community marks the 2024 International Day against illicit drugs and illicit trafficking, Nigeria joins the world to commemorate World Drug Day, a day set aside to raise awareness about the dangers of drug abuse and illicit drug trafficking. According to the National Drug Law Enforcement Agency, NDLEA, over 3 million Nigerians are struggling with drug addiction, with many more at risk of falling prey to the scourge.
In a recent broadcast, the commander of the NDLEA in Ondo State, Kayode Mumuniraji, said that a strong approach to drug abuse prevention is parental guidance and vigilance, stating that the war against drug abuse must first be won in individual homes. Joining us is the Director General, Kaduna State Bureau of Substance Abuse Prevention and Treatment, Joseph O. Ike. Good morning and thanks for joining us.
All right.
Great to have you on the program. Let's first of all, get some clarity on exactly what Nigeria's situation is with regards, drug usage and drug abuse. How much of a problem is it, currently across the country? And, maybe also specify if, there are certain regions that have it worse than others.
Okay. Well, thank you. The most recent survey we have, which also happened to be the most extensive survey that has been done in Nigeria to answer the question you just asked, was the National Drug Use Survey that was carried out in 2018. And that survey showed us that we have close to a 15% prevalence of drug use in Nigeria. What that means is that about 15% of the population between the ages of 15 to 65 had used drugs in the previous year. While that might not seem like a tremendously high number when you think just 15%, you may want to consider that the global prevalence is about 5%, which means that Nigeria has a prevalence rate that is about 3 times that higher than that of the global prevalence when we consider it from that perspective. Now, when we talk about how does this vary from region to region, unfortunately, the Southwest region has the distinction of having the highest prevalence of drug use at the time. And then, of course, we have places like the Northwest, and these are not unusual considering that these are also places where we have some of the highest concentrations of population. So the data that we saw there seem to be consistent with what the country actually looks like. Now, this was in 2018, while we're yet to conduct a follow-up, a national drug survey. Projections have said that some estimates have projected that the numbers are due to increase by as high as 40% from the last time that we had this survey. So we're looking at a significant drug use population in Nigeria. And of course, the first step before people develop problems with drugs is that they have to use drugs. So the higher the number of people who are using drugs, we can estimate that the higher the number of people with drug use disorders will be in the country.
All right, let's now bring into the conversation our guest here in the studio. We have Ifedayo Oluwole, who's a drug use and recovery therapist. Thank you very much for joining us.
Thank you for having me.
Let's look at the scourge of drug abuse in Nigeria and how well would you say we're faring, especially with helping people who have addictions with recovery? How do we have facilities that enable or encourage these treatments, and how are we faring really?
So I think that is one of the major issues we have in this country is the availability of facilities to help people come out of this. We have a few private ones, and there's one in NDLEA that they are doing fairly well, but people prefer to go to these private ones. There are free ones which accommodate a lot of people, and there are very expensive ones that people have to pay hundreds of thousands for like 3 months of rehabilitation and all. And this is why I think the government needs to pay more attention in creating more facilities. I think the NDLEA are proposing having more of these facilities across the country, which will help people to access recovery tools and help to help them come out of this situation.
What would you say is the typical? I mean, you mentioned 3 months. Now, for some of them, they have to stay for about 3 months. What's the typical duration for drug recovery? And also, do we have a number of people that are turning in? I know that Freedom House is one of the they're one of the people that are very active when it comes to helping with rehabilitation. But is it becoming a common conversation? Are we seeing more people venturing into the space to help with recovery for addicts?
It is cost effective. That is why for people to come into it, they have to think of the cost, what it will take, because it's going to be an inpatient program where people will be there fully through the course of that program. Now, talking about the duration, there are facilities that do a full year treatment, extensive treatment for a full year that help people. There are also facilities that do short-term treatments of 3 months, 6 months. But the basic thing is more about the user be willing and ready to come out of this, and sometimes also how long has this person been on the street. Imagine somebody that have been taking drugs 30 years, and the person comes into a facility. It's more work to do for the facility, and most times that 3 months is not enough. That is why we call people that have recovered from, we don't call them recovered addicts, we call them recovering addicts, because even after the program, you still have more to do. There's a lot of follow-up counseling that needs to be done after the time.
Yeah. All right, let's bring back Joseph Ike. I want us to also understand, because you did speak about, what the current situation is across the country. Can you clarify, for us, what drugs exactly we are talking about here? Which ones are the most used? And also, are there new types of drugs that are also getting into the Nigerian space that people need to be aware of?
Yes. Sorry. Before I answer that question, let me take up a bit on and elaborate a bit more on what the previous speaker had said. We do have what we consider a treatment gap, meaning that a lot of people who require treatment for drug use disorders do not have access to these treatment services. And this is due to a wide range of issues. Of course, we have stigma being one of the major barriers, that people do not want to come out and seek help. For those who want to seek help, it's either too expensive, it's far from where they are, the time they have to spend in the treatment compatibility with their own social lifestyle related issues. So all of these things create a wide treatment gap. And this is not just a problem in Nigeria, it's a problem across the world. And this is why this year, for the International Day Against Drug Abuse, the emphasis is on, if there is a treatment gap, if there's problem with access to treatment, governments need to prioritize preventive measures. While we try and sort out the problems we have on the treatment side, it's very important that governments devote a lot more resources to prevention of drug use disorders. And this is exactly what you see in a place like Kaduna State, where we have launched something called the Kaduna State Child Amplified Prevention System. The emphasis or the focus of this is to look at people between the ages of 0 and 18 years and see what system can we deploy to ensure that we keep young people out of drug abuse. We believe that if they have, if there are stronger systems, stronger preventive measures in place. And what do we mean by preventive measures? We're not talking about simply saying to people, say no to drugs. That doesn't achieve anything. To actually have effective evidence-based prevention, you must address the underlying vulnerabilities, the underlying risk factors. What are the things that make people use drugs in the first place? And you must have a system that addresses those things where you have young people and address that issue. And just to quickly answer your question, in Nigeria, everything that you can imagine that could alter the mind of a person is abuse. But most commonly, we have cannabis, we have opioids, and then we have a lot more new psychotropic substances coming up. But amphetamine type stimulants, if you can think it, we have it in Nigeria. So it's quite a broad scope of the problem.
I've seen a couple of, these balloons in nightclubs. Yeah. Is that also a problem? Is that something that you've also started to monitor?
Like I said, if you can think of it, if someone can take it and it can change the way their mind functions, it can change their mood, you can almost bet that somebody somewhere is abusing it in the country. It's impossible to even keep track. I know there's records of people inhaling toilet fumes, methane gas, and things like that just to feel high. So if we focus on one particular substance, I think we'll miss the plot entirely.
I also want us to talk, and I'll come to you in the studio, to talk about how, when we talk about drug abuse, a number of people focus on the big drugs. They're focusing on the heroin, the cocaine, and all the other opioids. But the misuse of drugs that eventually lead to drug abuse, I'd like you to talk to us a little more about that.
So one of the most common drug use among young people these days is what we call codeine. It's supposed to be a cough syrup. That is now, yes, codeine is now being abused by a lot of people, and people started abusing it because of the effect of overdose of this codeine, and somebody will just feel like he likes the feeling of what he gets from taking this drug. And this has gone wide than we can imagine in our society. It is now prevalent in secondary schools, private secondary schools, private universities. We have high rate of drug use in a lot of private universities around the country, which we are creating awareness. And I remember there was a time a facility I used to be with was making arrangements with private university to send, instead of expelling these students, send them to the facility for recovery, because it is another major issue, these over-the-counter medications that people now abuse.
Yeah.
Right.
Okay. Also, I mean, I think one of the things that we shouldn't, I mean, we did speak a little bit about it already, but recovery and, of course, you know, saving lives, you know, that may, of course, be struggling with drug addiction or drug abuse. Ms. Haike, speak a little bit more about that. Does the NDLEA or Nigerian government or private individuals need to invest more in rehab facilities for these persons? What is a thing that you believe that if we have a little bit more of, it would help those who are currently struggling?
Yes. So the short answer to your question is yes. We as a government need to invest more in providing accessible treatment services. However, I think, again, if we look at the model that Kaduna State is pursuing under the administration of Malam Ubasani, you would find that one of the problems we have in the treatment space is that we prioritize rehabs, the big rehabs where people go and stay for 4 months, for 6 months, for 1 year. And that's almost as if we assume that the problem of addiction develops over.
All right. It does seem like we're struggling with the network. Okay.
Rehab treatment centers are very important. But then those treatment centers, sorry, I think I lost you for a minute.
Yeah, well, we're struggling with your connection. We're struggling to hear you. But if you can wrap it up in another 10 seconds. Yes, we can hear you now.
Okay, yes. So I was explaining that the treatment centers, those big rehabs, actually focus on severe cases of addiction. We don't have treatment centers that cater to when the problem newly arises. So the earlier onset of drug use disorders, or the secondary level when they're mild to moderate, not necessarily